Hi everyone, my name is Lilian Rivera Montiel and this is my presentation. Patient-centered care directly influences clinical outcomes and the satisfaction of those who care for them. The study confirms that taking into account each patient's preference, value, and needs helps them adhere to treatments better and reduce the likelihood of returning to the hospitals. This not only impacts their health but also their quality of life. Furthermore, the use of technology to strengthen communication and generate empathy has had positive results in how patients perceive the care they receive. A recent meta analysis, for example, showed that in places where patients are encouraged to actively participate in their care, well being indicators are higher and there are fewer post treatment complications. Learning objectives. This educational program aims to provide each participant with a thorough understanding of what it means to provide patient-centered care and how technological tools can help achieve more empathetic and effective communication. Upon completion of the training, professionals are expected to be able to identify three tools that allow them to better connect with their patients, demonstrate clinical interview skills within a simulated setting, and actively support shared decision making. We also aim for attendance to analyze clinical satisfaction and outcome indicators before and after implementing this practice. We aim for clear, measurable goals that truly contribute to patients' overall well being. Instructional methods, VPS. To achieve these goals, we will use a virtual patient simulator, VPS, that combines realistic scenarios with immediate feedback. Platforms such as Body Interacts allow for real-time clinical interactions, where each user practices empathy, actively listen, and problem solving alongside the virtual patient. Unlikely a lecture or video, a VPS immerses participants in complex situations. For example, a patient with chronic pain expressing their fears and providers instant performance data. This methodological has been associated with more meaningful learning and skill acquisition in a safe environment, facilitating the transfer of the skill to the real life context. Resource and support. We have two main technological resources: Body Interact for 3D simulation of clinical cases and SimCam Capture for recording, reviewing, and discussing each session. The former allow for the recreation of vital signs, emotional responses, and decisions of the virtual patient, while Sim Capture facilitates a structured debriefing after each simulation round. In addition, we will have rooms equipped with computer station that meet the hardware and software requirements and dedicated technological team that support the platform. To complete this, we will assign specialized instructions in health and nursing informatics. We will also lead these sessions and provide evidence-based feedback. Timeline. The curriculum design will begin in June and July 2025, during which the clinical cases and competencies to be assessed will be defined. In August 2025, we will conduct a pilot program with a small group of nurses to validate the platform and content, gathering feedback for possible adjustments. September will be dedicated to incorporating suggested improvements and preparing user manuals. In October, we will train the instructors who will implement the simulation. Their training will ensure consistent feedback. Finally, the program will be formally implemented in November 2025. Hiring plan. To invite participants, we will work closely with the nursing director of each location, defining ideal profiles based on roles and shift. Invitations will be sent by institutional emails with all the necessary information, dates, objectives, and requirements. Those interested can register online using an electronic form, and the system will send an automatic confirmation to ensure clear registration and avoid overbooking. Throughout this process, we aim to ensure that the most suitable clinical staff can participate. Communication. The program will be disseminated through the institutional intranet and emails, as well as posters posted in common areas of the nursing units. Informational meetings will also be held beforehand to address questions and motivate staff to participate. To maintain interest and ensure attendance, reminders will be sent via international measuring 48 hours before each session, and personalized follow-up will provide to those registered to confirm their attendance and provide support with any logistical issues. Contingency plan. Should any unforeseen technological issues arise, such as deadboard failures or problem accessing the VPS simulator, we have a backup plan in place. We will use recorder simulations and analyze clinical cases through guided discussions. Additionally, if the recorded simulation and analyze clinical cases through guide discussions. Additionally, if the number of participants exceeds room capacity, we will organize alternating groups to ensure the quality of learning is not compromised. Each of these contingencies will be addressed in rapid action protocol designed to respond quickly and effectively. Evaluation. To evaluate the success of the program, first, we will administer pre and post training surveys to measure changes in knowledge, attitudes, and perceived skills. Second, we will directly observe performance during the simulation using a validated rubric that assesses communication quality, empathy, and decision making. And third, we will analyze real world indicators such as patient satisfaction and treatment adherences after the intervention. At 6 months, we will compare the readmission rate and satisfaction survey results with historical data from before the program. Thank you.